It is 5:21, and just as research is being done to find a cure for breast cancer, there's also work and resources for the mental toll such a diagnosis can take. And as we found, focusing on the mental side of the fight can literally save lives.
I got married when I was 29 with the intention of having a family.
5 years ago, Emily Richmond was ready to move into a new phase of life. But at her young age, she never knew that phase would be dealing with breast cancer.
And at age 30, I found a lump and reported it to my doctor. A couple days later, I got a call that yes, I did have a little, quote, little breast cancer in my left breast. Yeah. So that was earth-shattering, as a working, hopefully parent, it was earth-shattering. And
a nurse herself, she still felt unsure where to turn or where she'd gone wrong.
I have no cancer in my family of any kind, breast cancer. Nonetheless, my mother taught me at an early age that self-exam is, part of your health and upkeep as a woman.
Within a week of her diagnosis, she found Cleveland Clinic health psychologist Dr. Kathy Ashton.
I think it's important for patients to check in on their mental health at different points along the way in their treatment. So when they're first diagnosed, when they first go through surgery or start chemotherapy, those can be trigger points at which they will notice an emotional reaction.
You were scared? Oh yeah, I mean, a lot of that first month, I can't even remember. And here's where we cry.
Dr. Ashton works at Cleveland Clinic Cancer Center's psychosocial oncology program, where they offer counseling, psychiatric evaluation, and treatment for breast cancer patients specifically. And the research into this type of counseling is eye-opening. In 1994, Ohio State University's Dr. Barbara Anderson studied 227 women diagnosed with stage 2 or 3 breast cancer over 15 years. Called an intervention, the women went through targeted therapy and improved health practices like diet and exercise. Those who stuck with those changes were revisited, and patients who hadn't been re-diagnosed had a 45% less risk of reoccurrence, while those who were diagnosed again had a 59% less risk of dying from breast cancer. And the method of revisiting these patients after surgery is crucial.
So a lot of breast cancer patients will still be taking a medication for 5 to 10 years of their life that can make them feel like they're in menopause. If you're a young woman, that can be pretty disturbing. There's lots of symptoms that can continue after your treatment. So you could have neuropathy or so pain issues that can continue after treatment. You can have fatigue.
Pair that with mental stress, and some patients even stop chemotherapy. But Emily says treating her mental health is what saved her physically.
I was telling my girlfriend the other day, she also got breast cancer very young. She's 2 years out, and I was telling her, we're on borrowed time. We're not supposed to be here. Let's make the best of it. Let's really make sure we make a difference.
She is one strong cookie, and we're happy to say Emily did give birth to a baby boy in 2019, and she tells us that she still sees Dr. Ashton and just checks in with herself nowadays to decide how often she needs to see her, and sometimes it's more than others. Mm-hmm. She's pregnant as we speak with baby number 2.
Excited for her.
And she just has such a great attitude, but she was so transparent, and Danielle, I know we've talked about this too, the mental toll, and I know that you can relate to that because she said that she doesn't even remember.
Right. She said the first month, when I was diagnosed in February, March was like a blur because you have to make so many decisions quickly in terms of your care, and then sometimes your mental health kind of takes a back seat because you're like, oh, I got to make these decisions. But right now for me, I tell myself I'm in a healing season, and the doctor was correct. When you take those medications, I'm on a medication for 5 to 10 years, and it could actually impact your mood. And so I'm constantly watching, okay, am I feeling sad today? Is this because of just the situation or just the medication. So you got to constantly take care of your mental health.
You got to check in.
Those statistics too about how just your mental health, the impact of keeping cancer away or improving your risks, it's incredible.
Yeah.
I mean, that was really what hit me the most, was just the mind frame that you need to be in.